Hello everyone, my name is Dr. Becca Allen and I am a physical therapist who specializes in pelvic health, but I also teach menstrual cycle education for teens and adults and natural family planning. And one of the things that I get a lot in those classes for menstrual education as well as my pelvic health patients is, how do I insert a tampon? How do I insert a menstrual disc? How do I use those things? I've always just stuck with pads, or I've always just stuck with tampons. So today I thought we could talk a little bit more about these things, how to insert them, how to use them, so they're not so scary. Also, for teens that just started their period, I cannot find a great video. So I think this is going to be a great video for teens, especially on how to find their own anatomy and then how to use these products. So we're going to talk a little bit about anatomy and then all the different types of menstrual products that you can use and how to use them. First off, a little bit about anatomy. So this is your pelvis. Right now it's sitting in my body kind of like this. So we have two of our vertebrae here, the lower part of our spine, as well as two halves of our pelvic ring. If I turn it around, so now I'm looking at my buttock, we have our tailbone down here, as well as our last bit of our fused vertebrae here. And then we have our pubic bone in the front. These bones are sometimes called our sits bones. They're the bones that we can feel like if you wiggle around on a hard chair. All of this is your pelvic floor muscles in pink. That's what I specialize in. But today we're going to be talking about the different parts of the vaginal anatomy. So your vagina is basically just kind of this opening in your pelvis for reproductive purposes. That is lined with basically like skin tissue. So it's not just this open cavity where everything can go. It is definitely a closed house. So when we're talking about some of these internal things for menstrual cycles and bleeding, catching blood during our period, they can't go anywhere. It's a closed circuit. So you're not going to lose any of these things. But what I want to see is, how do we find our anatomy? So if you can tell, we have our pubic bone on top. So this person is now kind of lying on their back, okay? You can feel a hard bone kind of right at the top of their pelvis. And I'll show you how to find that when you're sitting down in just a second. Then you can see their urethra is kind of right up top there. And then the bigger hole right here is that vaginal opening. Now, all of this has skin taken away. So in real life, there's a bunch of skin, there's some extra folds and things. Those are called your labia. Those are normal. And a lot of times when you're in puberty, those will get bigger. So sometimes teenage girls will kind of be a little bit like, wow, there's a lot of stuff going down there. That's normal. Sometimes in order to find these holes, you have to kind of separate those out a little bit, okay? So we have our pubic bone on the top, and then if that first hole is called our urethra, it's where the pee comes out. It's very small and sometimes even just feels like a little bit of a bump. You're not really going to feel a big hole that you can put your finger through. It's very small. And sometimes it's kind of tucked in teenage girls or in young girls who have not had babies yet. And then the vaginal opening is this bigger hole down here. That's the one that we're going to be using. That's that closed house. Like I said, it's a vaginal canal that has skin around it and then ends in our cervix and our uterus. We can't lose anything in there. That's the opening that we're going to be looking for when we're talking about menstrual cups, discs, and tampons. That in teenagers is or someone who has not had sex or used a tampon yet is closed with a little bit of skin. Now, it's not completely closed. Sometimes there's a little bit of holes in there. Sometimes there's some thicker tissue around, but then there's some thinner holes on the inside. That tissue will break when we use a tampon or have intercourse for the first time, sexual contact for the first time, any sort of vaginal penetration. That is called the hymen. And a lot of times that sometimes can make that hole kind of small to begin with. So like I said, usually it's not that big, but it is bigger than your urethra, that first hole. So we're going to be looking for that bigger hole down here. And the vaginal opening is also, I usually say it's about a little bit bigger than your thumb when you're before babies. So it's not too big, but we are looking for something that we can kind of put our finger or our thumb inside. So in order to find that, let's say you have your pants and underwear off, and you're sitting or squatting down. You're going to take your hands, and I like to start at my belly button because it's easy to find. Start at my belly button, and I walk my hands down my belly until I feel on my pubic bone. And then I'm gonna keep walking my fingers, so that pubic bone, that hard bone right here. So you're gonna feel that, oh man, that's really tough and hard. That feels very much like a rock. That's probably your pubic bone. You're gonna push pretty hard, you're gonna push pretty firm, and then you're gonna go to your pubic bone. Then you're gonna keep walking your fingers down. You remember, you might have to kind of separate that skin, and then you're gonna find that opening, that vaginal opening, where maybe you start feeling your finger kind of slip inside, or feel your finger slip into a hole. That's the hole we're looking for, okay? So we have your urethra, that hole on top, that just kind of feels like a bump. That vaginal opening where we can actually fit a finger inside, or we feel something kind of slip a little bit more inside. Remember, you might have to open up some skin to feel these. You also have your anal opening down here. That's not what we're looking for either. But there is kind of a space between that hole that we want and that anal opening. So now that we know where our vaginal opening is and what it we can find it, that's where the blood comes out when we're on our period. So this is where the blood comes out. When you're standing up, it's kind of right directly underneath of you, okay? What can we use to catch the blood during our period? So a lot of times, the first things people will use is pads. Pads come in a lot of different shapes and sizes, and everyone bleeds kind of differently. Some people will bleed more towards the front, towards the back. That may even change as you grow up. So you're gonna open up your pad. It will probably have a sticky part on the back that goes into your underwear, and then that absorbent material on the inside, as well as a lot of pads will have wings that go on either side of your underwear to help keep it in place, okay? So I would stick this in my underwear, and then I would kind of tuck those wings around the underwear so that way it stays in place. And like I said, this one's symmetrical, but sometimes they'll be longer on one side or shorter on one side. And then you can, based on how you're bleeding, you can use that. Usually these have to be changed every time you go to the bathroom or every few hours, but can be worn all day. There's not a big risk of infection. So usually we're wearing these until they get full, and then we're tossing them in the garbage. Don't flush them. The other thing that we can use, so these are disposable. The other thing we can use that's disposable is a tampon. Tampons kind of look like this. They have a string attached to them, and they usually come in an applicator. That applicator, you're gonna pull it until it kind of clicks in. Okay, so you're gonna pull it out until it clicks and is stuck in the out position. Then you're gonna take the tampon, and I like to say sit on the toilet is an easy way to do it, or squat down if you're feeling a little nervous about it. Sometimes other pelvic PTs I've seen, you can do it kind of reclined in your bed, but sitting on the toilet is one of the best ways to do it. Just be careful you don't drop it in the toilet. But you're gonna sit in the toilet, you're gonna walk your fingers down until you find that hole, and then what I say is kind of insert that tampon about an inch or two inside of your vaginal opening before you push on that thing to release it. So we're gonna put it into our vaginal opening, and then you're gonna push down, and that's gonna release that tampon into your vaginal opening, okay? So I'm gonna take off these first part of muscles just so they're not in our way, and we have a little bit larger opening now. Now this is a little bit larger than your vaginal opening normally is, but you're gonna put that, take that applicator, you're gonna put it about an inch inside, and then you're gonna push it so that now that tampon is gonna be inside your vaginal canal. That string will sit on the outside, okay? Usually it doesn't really bother you, but it's a good way to be able to find it when you're ready to take it out. So that would be if things start kind of leaking outside of it, you're finding some blood in your underwear, or if it's starting to slip and move around, you're gonna find the end of it, find that string, find the end of the tampon, and then you're gonna pull it out, okay? Now, when you're inserting it, you kind of insert it back towards your bottom. As you pull it out, you're gonna pull it down and out. You're gonna wrap it up in toilet paper, and then you're gonna put it in the garbage. Don't flush it. Okay, so that is tampons. Now, some of my patients with chronic pain with their periods who are having some hormonal issues, teens as they first start their periods, tampons sometimes will actually cause more cramping. But they don't want to use a pad because let's say they're swimmers. I just had a swimmer come in, or they're really active in sports, and using a tampon or using a pad is just not really going to work. As well as tampons can be worn for about 8 hours, usually up to 8 hours, and then they need to be taken out. Menstrual cups and discs that are reusable can be worn up for 12 hours, and we don't have as much of the risk as infection as sometimes we do with the tampon that absolutely needs to come out after 8 hours, or else that infection risk goes up. These can be worn for 12 hours, and the risk of infection is a lot lower. So let's talk about menstrual cups and discs. So menstrual discs are kind of this disc shape. Some of them have like a tail, some of them don't. They catch the blood in here. These ones are really nice for beginners, especially someone who's never used reusable products before, anything silicone before, because they get really nice and small, kind of like a tampon size. You insert it the same way we did with that tampon, but once it's inside about halfway, you start to let it open. Then you're gonna push it until it starts to feel a little bit like some firm resistance, and then you're gonna push that edge of it up towards your pubic bone. So I'm gonna insert it, and then I'm gonna push that edge of the disc up towards my pubic bone, and that's what helps it stay in place. Now, discs can be worn for up to 12 hours. They usually hold quite a bit of fluid, about 5 or 6 tampons worth of fluid, which is nice. When you're done, you're gonna pull it down and out like we did with that tampon and dump the rest of the blood, or that blood, into the toilet. Sometimes these will kind of empty on their own as you go to the bathroom, but after about 12 hours, you're gonna have to take it out and dump it. And then we're gonna wash it with hot water. And there are some reusable soaps, like reusable disc soap or wipes. Pixie is a great brand that has some different wipes. I think Diva Cup might have some too, or washes. So you're gonna wash it, or you're gonna rinse it, you're gonna wipe it down if you're on the go, and then you can reinsert it. So another thing about reusable stuff is once you have one, you just dump it, rinse it, reuse it, and then you sterilize it at the end of your cycle, at the end of that cycle. Cups, very similar, can be worn for 12 hours. You're gonna dump them out in between and wash them with hot water or some sort of like reusable cup soap or wipes. You're gonna fold it, which there's a bunch of different folds. One is a punch fold. Another one is a U fold. So I kind of like punched it and then folded it in half. The biggest thing with the cup is we need to get it in place, and we need to make sure it's open. So I'm gonna punch it down just so that it's nice and almost like small, like a tampon. I'm gonna insert it down or towards the back of my bottom, just like I did with the tampon and my disc, but this time I'm gonna let it open. It's held in place by our muscles and suction, so it's not gonna come out. And like I said, your vaginal canal and opening are a closed system. You're not gonna lose this cup inside, or this disc inside, or this tampon inside. They're in there somewhere. Even if sometimes it feels like you can't feel them when they're inside, that's actually a good thing. It means they're comfortable, but you can always usually find them. So you're gonna insert this, you're gonna let it open once it's in. I usually say, try to take a finger and kind of squeeze it or push it to make sure that it's fully open. There's no like creases or anything. So make sure it's open, and then once you take it out, you're gonna break the suction with your finger, and then you're gonna pull it down and out, dump the blood out, wipe it down, hot water, rinse it off, and then you're gonna put it in again. Like I said, these can be worn for 12 hours, and then usually with the reusable products, most companies will recommend that you sterilize them at the end. Another great thing is they're starting to come out with disc and cup applicators, which I think is a great idea for teenagers or people who are worried about discs and are just like, I have no idea how to insert this. You now have this nice applicator. Pixie makes a great one. I think there's a couple other companies too. Pixie just sent me theirs and I love it. But you're gonna insert, and then it'll actually naturally just kind of insert a lot better. So they do have applicators as well. I hope this was helpful. I know that there's a lot of videos like this out there, but I feel like I never quite found something quite like this to direct my younger women too, or my teenagers, or those that are just starting to experiment with different things to catch their flow. And so I thought that I would do a video on all the things that I normally recommend. I didn't have any period underwear today. Those are very popular right now, and they're really easy to use. The nice thing is that they're starting to get really thin. So you wear them like normal underwear. You can wear them for they usually hold a few tampons worth of blood or pads worth of blood, and then you can put them and wash them in hot water in your laundry, and that's also a great way, and they're really comfortable, which is awesome. So definitely recommend those. But yes, if you have any questions, let me know in the comments. I'm just really excited to share this information, and I'm hoping to share more videos about menstrual cycle education. Let me know if you want to see anything else.